Good. Good evening, good evening, good evening. Peace and blessings, everybody. Welcome to the October 7th Human Services Committee meeting for Manhattan Community Board 11. My name is Isaac Scott, and this meeting is called to order at, I'll have digital time, 6:06 p.m. Oh, 6:08, sorry. Tonight we are joined by Marlene Pierre, the staff liaison for our committee. In order to conduct an efficient meeting, let's observe some ground rules. No one may speak until granted the floor. CB11 members, if you have a question about board business or wish to make a motion, please raise your hand and wait to be recognized. To raise your hand through Zoom, click the participants icon and you will find the raise hand function there. Members should not engage in a back and forth discussion. The chair will recognize the next person to speak. Please keep your questions and comments brief and on topic to the discussion. Members of the public, if you have a question or a comment or about subjects on the agenda, please raise your hand and wait to be recognized. Now we'll do roll call. Committee members just say present when you hear your name.
Mark Roberski,
Present.
Marcel Bodina, Rosa Diaz. Present. Arnice Foster Hernandez. Present. Jennifer Meyer. Present. Valerie Ponce. Asher Rodriguez. Isaac Scott.
Present.
Robin Stration.
Present.
Alida I don't want to mispronounce. How do you pronounce her name? T-Combound. Just have to say, okay. We have a forum.
Perfect. Thank you, everybody, for being here. The agenda for tonight's meeting was distributed ahead of time by the board office. If there's no objections, we will adopt the agenda for this meeting. And you have an objection?
No, I moved to.
Okay, great. Okay.
Approve them.
Seeing no objections, the agenda for tonight's meeting is adopted. The minutes were also sent out earlier today for last month's meeting. If there are no objections to those meeting minutes, the minutes from last month's meeting will be adopted as well. Seeing no objections, the meeting minutes from our September 9th meeting are adopted. From there, let's go into announcements. And we'll have, I'm gonna turn it over to Rosa to give some announcements.
Yes, thank you so much. Everyone, these are some announcements from the East Harlem Community Partnership. They're having, just in case full disclosure, I am part of the governance team and I get tons of emails and I love to share information. October 11th, we're having a senior vaccination, again, October 11th with the Ryan Health, in the senior building, Carlos Wheels in 105th Street. And October 16th is gonna be general vaccination from 10 to 2 p.m. in Ryan Health in 105th Street. I will send the information via email also to Marlene so she can share it to everyone. And also stop by Borinquen Neighborhood Health Center to get your free vaccination for the flu season, 9 to 5 p.m. And another announcement, we're having CPR training this Saturday, October 12th, from 11 a.m. to 2 p.m. If you want to participate, please send an email to info.ehcp@gmail.com. I will also send this information to Marlene. And last one is we're having a fire safety workshop on October 22nd at 11 a.m. Again, if you would like to join, please send an email to info.ehcp@gmail.com. It's October 22nd from 11 to 12 p.m. at 71 East 111th Street in the 2nd floor. And I will send the information to Marlene. Thank you.
Thank you.
Thank you, Rosa. Are there any other announcements from committee members? Any announcements from the public?
I can make an announcement.
Yes, please.
Hi, Antonika James from the Connect program at Housing Works. Our clinic is located at 145 East 125th Street, so we are on 125th and Lexington. We are having a free cider event this Wednesday in collaboration with Uptown Grand Central. So, on Wednesdays, Uptown Grand Central usually has a food demonstration happening while they're selling the produce and everything outside. We will be offering hot cider to folks who come by and participate in our community survey. And so we'll have people answering a few questions, and then they'll be able to get a free cup of hot cider. And we also will be distributing health bucks to some of the public that come by. So people will be able to buy some fresh produce and fruit from the farm stand. And that will be this Wednesday, October 9th, from 1 p.m. to 4 p.m. I can send Marlene the flyers. There is a registration QR code that people can sign up for, and we'll just be able to track folks that way. And the second thing is on Saturday as well, October 12th, the Neighborhood Action Center will also be hosting their fall health festival. So there will be a lot of health organizations out tabling on 115 and Lexington at the Neighborhood Actions. And that's it.
I have a question.
Yeah.
For how many health bucks will each person receive?
So we're trying to decide that now. It might, we're kind of doing more, we're trying to do more. So, we'll see, but for now, I'll say at least, yeah, at least 4 or 5 bucks.
Any other questions? Yes.
Just quick announcement. My name is Alex Brass. I'm a neighborhood navigator with the Bridge. I do street outreach in the area, focused on individuals who are unhoused, have substance use and mental health issues. I walk around anywhere from 125th to 110th Street, from Lenox all the way down to First Avenue. So if there's any way that me and my team can support, we take referrals, we'll come out to, any of those areas. And, go there to assist individuals. We also have a monthly stakeholder meeting at our office on at 290 Lenox between 125th and 124th. Anyone is welcome to, we have people give presentations. If anyone just wants to come and give suggestions on, how we can best assist the, people out here. We'd love to have you. Our next meeting's October 15th from 12 to 1 p.m.
Thank you. Say your name again.
Alex Brass.
Alex Brass. Alex, I think someone had came last year from the Bridge, and I believe that we asked them if you all would be willing to come back to get, no, I think if maybe I'm wrong on the organization, but I believe it was the Bridge program. And they were letting me know that they were in the process of getting navigators. So you are a new navigator?
Yes, I'm new.
Okay.
We just started the program in January.
Okay, I'm sorry.
I'm new as of June. We just had our 3rd team member, so.
So would you all be willing to come regularly to give some monthly updates to the community about the work you're doing, but also maybe just expressing some of the maybe challenges and maybe how the community can support you in the work that you're doing?
Yeah, I'm happy to do so. I need to get approval from my supervisor, but I'm pretty sure she'll be more than happy.
It doesn't need to be a
To
person.
do so.
Yeah, it doesn't need to be in person, and it can be anyone from your organization, if you're like out on the streets, because I don't want to take you out of the streets to be in the office, because the purpose of your role is to be in the streets, so sitting here is kind of counterproductive. So I appreciate you. Could you say just like your information on the record so that people who are here and have it, like your phone number, email, so that other people who are on.
Yep, my phone number is 646-596-1165. My email is agrass@thebridgeny.org. If anyone has any referrals they want to send, please call 212-423-5733, or email us at neighborhoodnav NAV@thebridgeny.org. Thank you.
Thank you very much. Thank you everyone for the announcement. Are there any questions, from the announcements? We had announcements from Rosa Diaz. We had, Anthony James and, Alex Brass. Did I say that right?
Yeah.
Okay, any questions about any of these, announcements? Is there anyone in the virtual space with a question? No questions in the room? Thank you all very much for the announcements. I love it. I encourage you to keep coming with announcements, no matter how small they are. Everything matters, and in human services, our scope is wide. So bring it, like human services. If it's working for people betterment, then we need to know about what's happening. If it's just extracurricular activity to keep people busy and off the streets or in shape, whatever it is, all of that matters. So please bring all of the announcements that are relevant to the human services committee. With that, we can transition into our informational updates. Our first update will be from the Department of Health and Mental Hygiene. Do we have Paulina?
Hey everyone, good evening. It's Pauline from the Health Department. I am also bringing some good information about free COVID and flu vaccinations. So beginning Thursday, October 17th through Wednesday, October 30th, we will be having free flu and COVID vaccine clinics at the East Harlem Health Action Center, located at 158 East 115th Street. These clinics are from Monday through Saturday from 10 a.m. to 8 p.m. And we really want to focus on all the Harlem neighborhoods, Washington Heights and Inwood, especially seniors and people without insurance. So we are not blasting this information far and wide on our social media because, again, we want to focus on Harlem and Washington Heights and Inwood residents. And so we don't want, space to be taken up by folks outside of those very important zip codes for our agency. But we would encourage the community board to please share this information with your membership and with your community. So I will forward Marlene the information so that she has that as well. And I'm happy to take any questions. Thanks so much.
Thank you, Pauline. Was everyone able to hear? Sorry. Thank you, Pauline. Are there any questions? I see a hand up in the virtual space. Who's that?
Lily.
Hi, everyone.
Hi.
Hi, my name is Lily Lopez, and I represent Night Connects, a Center Independence for the Disabled of New York. And we help people with disabilities. We connect them to services and resources. We assist with housing applications.
Lily,
Can you hear me?
sorry to interrupt you. Could we finish just asking, see if there's any questions?
Oh, okay, I'm sorry.
And then you can go and get the announcement, which it sounds like that's what you're doing. Is that?
Sure.
I'm trying to, there's something I can do about this. I'm trying to, as you guys have your meetings, to fix this audio in the background. So bear with me.
Take your time. Yes, before we go back to Lily Lopez, were there any questions for, yes, Robin, please.
Hi, Pauline. Is any registration required for your free vaccination program?
There is no registration required, but we do ask people to call just in case, any day might be busy. But since it is open from 8 a.m. to 10 p.m., I'm sorry, 10 a.m. to 8 p.m., we're hoping that, the attendance is spread throughout the day. But we will provide the number for people to call to make an appointment if they choose to. And that number, I can give that out right now. But of course, I'll share all this information with Marlene. But the number to the Health Action Center is 855-789-8760.
Thank you.
Thank you.
Thank you, Pauline. Are there any other questions for Pauline Ferrante from the Department of Health and Mental Hygiene? Okay, seeing no hands, thank you very, very much, Pauline, for being here, for providing those updates.
Thank you.
Okay, so, our next set of updates is from the East Harlem, Emergency Management Organization, East Harlem COAD. Who do we have on tonight? Who do we have? Anyone from East Harlem COAD today?
I'm saying.
Okay. So, all right, I'll follow up with them. So our next set of updates would be from the Center for Comprehensive Health Practice, CCHP. Do we have Shannon on? I think I
Yep.
see.
Hello.
Hey Shannon, how you doing?
Good, thank you. So we have two updates from CCHP. One is we now have a new provider, a male provider who speaks Arabic. So that's great for our community members who speak Arabic, and he is a great provider and he works really well with our patients. So that's one update. And another update is we are initiating new programs so we can reach harder to reach populations. One specifically for the reentry program, reentry people who are in reentry, also those who have substance use disorder and are currently pregnant or postpartum. And also we are that is also including people who are younger, like we're talking like adolescents to like early 20s who also have substance use disorder. Right now we are kind of like doing a linkage program. So even if we can't provide services to anyone in those populations, what we're doing is we are still taking them and we're referring them to places where they can get the services they need if we don't provide that particular service. So those are my two updates.
Thank you very much, Shannon. Are there any questions for CCHP? Cool. Thank you again, Shannon. Appreciate you.
Problem.
Okay, if I'm a betting man, I'm gonna bet that, never mind. Is there anyone on from Memorial Sloan Kettering? Okay, all right, y'all, so with that, we have no more informational updates. We can get into, what we came here for tonight.
Oh, you wanna go back?
Oh,
to
do we
that
have
Lily?
enough?
Lily, that Lily person?
Oh, Lily, sorry, Lily.
Hi, everyone. Thank you.
So can I ask you a question? Are you giving an update or are you trying to give a full presentation?
No, this is no, not a full presentation. I just wanted to describe my program briefly, and if you have questions, you could ask me or I can return in the next meeting.
Thank you. The
So
floor is yours.
okay, so the Night connects people with any disability, any age to services and resources, or it can be based on people's needs. We assist with housing applications, Medicaid, OPWDD guidance for people with intellectual disabilities. Or like I said, we can also connect them to resources. We can also assist with the 2010E applications for substance use. And all of our services are free of charge. I will be sending this information to the board so it can be shared with you. And if you have questions, you could email me at lopez@c as in cat, idny.org. My cell phone number is 646-457-5364, and our main line is 844-862-7930. Thank you.
Thank you, Lily. First, are there any questions for Lily about the organization she just described? Lily, it would be great if, you came and gave us a full presentation at our next meeting or
Sure.
the meeting to that. So what I'll do is I believe I hustling and I think that our secretary wrote down your email over here. So I'm gonna follow up with you and formally invite you.
Sure.
But we would love to like hear a full presentation and see some pictures and get to know what you're doing more.
Sure. Thank you.
Of course. Okay, I'm sorry about that too. I didn't leave anybody else, very good. All right, all right, cool. So moving along, y'all. All right. So I just want to commend all of the hard work that has been done over the year that has gotten us to this point to where this meeting is going to be very smooth. I also want to say thank you very much to Marlene for all of her hard work and for this. I love how she put our priorities on the document,
Yeah.
but also like so as we go through, we can rank them because that is a huge part of what we need to do with the priorities, not only ensuring that the priorities are an accurate budget type, right? The explanation is strong, but also ensuring that we rank them based on the priority we would give them, you know, high, medium, and low. And of course, all of these are high priorities, but, you know, we'll do our best to prioritize these. So thank you, everyone, for just working on this. So we can go, I was wondering, actually, Marlene, is it okay if you pull up the survey results? Just really quick, so we can just go through that, just briefly, just look at some of the visuals there as we transition into this. Thanks. Did everybody here have the opportunity to take the survey? So what we do, we can look at that really quickly for a few minutes, discuss whatever stands out to us. And then we'll go through these priorities. Some of these were re-articulated, redrafted to be stronger, some were taken out. And then we have some new ones. And so we're excited about that. Cool. We got 92 people finished it. I mean, 91 people. That's 20 more people than it was when I looked at it last time. And then like 20 more, yeah, so it's good. So this is a note to us that when these surveys come out, so let's just stop there for a second. 91 people filled this out of how many people in this district? You know what I'm saying? So this is nowhere near representative of, you know, the people in the community. We appreciate everyone who did fill it out, but we have to do a much better job at getting this survey out. So perhaps, but I'm gonna put you to work. Can we just like some just rough goals? Rough goals. One goal would be to ensure that our next year's survey, we get at least, let's aim for 200 people, maybe 250. That's our goal, to just try to get it out to the community. I know it's not just our responsibility, so we'll work along with the rest of the board, and we'll present this, you know, when we give our report, that, hey, this is the goal. There was only 91 people. We want to at least, I mean, I'm sure we could get to 500 if people actually worked, you know, if we, you know what I mean? So I would just say 250 to be, you know, but anyway, we should have some goals this number should increase every year, you know, to the point where it's in the thousands, you know, and it's in the tens of thousands, so that we can have a much more representative, I know, but, you know, I'm ambitious and aspirational. No, this is for you to just, as I run off my mouth.
Okay.
But if anyone else, if stuff comes to mind to you all, just throw it in the air, spaghetti on the wall, this is our wall, right? So yeah, that was just the first thing that came to mind, because I was like, how many people did it? Okay. We can keep, any other thoughts? Yeah, please, come on, jump in.
I got some spaghetti for you.
Come on.
So I don't know when the survey's ready. When is it usually ready? September, okay. Big health fair for seniors happens right after Labor Day. I would be willing to take a table and work on this with the 500 plus people that come, but I wish that there was some little thing from CB11 to give them for doing it.
That it's on the table since Carly Wine was ADM. And so Carly Wine used to have a paper form. And that was kind of cumbersome to have them like read this long thing to fill out the survey. So what was implemented this year was a QR code. And so that probably discouraged some of the seniors at the Fire of Aging.
Yeah.
To scan the QR code.
I'd be willing to sit and talk with them about
Yeah.
it one-on-one.
Yeah, whoever is staffing that table, we usually do sit down and talk to them. That's an incentive to get our swag.
Do you have a table at the senior resource, the Power of Aging well?
Yeah, every year.
You do?
Mhm.
Oh, okay.
Yeah.
All right,
So we usually do, it's usually, if you want a pen, fill out the survey.
great.
That's usually how it is. Sometimes we get, informative responses, and sometimes you just scribble,
Right.
like it's really like.
I know people are just looking for something for you at that event.
Yeah, so, not all the time, but this year to move the line along, we would like, scan this thing, fill it out when you have a chance.
I can imagine hardly anybody did.
I'm not sure.
Most
about
people
senior
took a picture
people.
of the flyer, cause I was tabling with it.
Right, we did also, yeah, we did a flyer and put the QR and, get it out to people, share it.
You know what could also help, being on, and I'm happy to have this, like, have devices on site for people to fill it out right there.
Mhm.
You know,
What a great idea.
you know what I mean? You could
Yeah.
have a tablet or two for
Yes,
people
you
to fill
could.
it out, you know what I mean, right on site, so that's awesome.
Enlarge it.
Can we put some spaghetti on the wall for like that, like, just having,
Spaghetti.
some devices
I
available.
would recommend someone would need to be there to help them with that, because I tabled at the same event. And we had the same results with our survey, was that we needed people to, even if we had a device, we still needed to ask them the questions and like,
So that's, too. So not just a tablet, but someone. to-
One-on-one help.
Mark, I saw your hand go up.
Well, I'm just curious, do we have the contact information of people who did fill out the survey?
Big now.
Did? Do we know how to get back in
I
touch?
don't think so. Did you put in your information when you? filled it?
No, I don't remember. Okay, so I mean, is it
You
we,
trying to stalk people?
no. Not trying to stop people. Strike that from the record. But, no, it just, people fill out a lot of surveys and if they never hear anything back, it's not really incentive to do it again because you figure like, what the heck did I do that for? It just goes into an empty place. So if we send out the results of what we submitted as a result of the survey, that might encourage them not only to do it again, but to talk to other people that this actually has some value. But we can't if we don't know how to get back in touch with the people who filled it out.
So it sounds like incentives and.
Feedback.
Yes, incentives and also expressions of gratitude.
Well, or
Yeah.
just showing that it was actually looked at,
Useful.
it was actually used, it was
Yeah.
actually.
City releases though, right?
This one.
Doesn't the city kind of, or is this one that CB11 specifically released?
This is the CB11 specific, but a lot of the questions are coming from the Department of City Plan.
Okay.
Mhm.
Do we have availability to like change?
Some of them, yeah, but you want to tailor them to DCP's questions for the budget.
So we can keep scrolling.
So how far do you want me to scroll?
So let's just keep going to read something that make us get us excited and riled up. Okay, let's. What were some of the most pressing issues? Yeah, this is good. Could you tell us what those,
It's always the first one you see, it's always affordable housing,
Yeah.
yeah, it always every year.
Yeah, and then that one.
And then this one seems like it's prime. And the next one,
Yes.
Well, trash removal is big and quality of life is very big. This is the general one, right? Not the more specific one that's targeted to us, right? So. The crime and public safety is even more than hard affordable housing.
Yes.
Yeah.
Talking about trash,
All right, there we go. Thank you. That's.
our beautiful
Finance,
streets,
basically, yeah.
for some reason, seem to be dirtier like than never before. In my point of view, I just walked the whole Park Avenue from 132nd,
Are you all far?
Park is, yeah.
Yeah, if you all far, you definitely should have worked.
and it's both sides.
Yep, park is.
I blame dog owners, but I mean.
Let's clean it
I
up.
know, that's why I didn't listen.
That's the key word.
You shouldn't blame dog walkers, you should blame all dog walkers.
Some.
It's that poop is not from feral dogs. It's.
I recently moved from 125th, like compared Park, 125th. Whereas Adley Park seems pristine.
Okay, 125th is worse than Park Avenue? Wow, oh, it's bad.
Yeah, but, so what do we, no, but really though, I was thinking about, and again, this is, I don't know what this looks like, you know, and this may not even be the time, but I wasn't really thinking like, what sort of initiatives can take place to really encourage people to really, you know, curb their dogs better. You know, some, you know, and it was, this was really targeted toward dog owners who do not, because I do see it to Jen's point. I do see a lot of people say that, I really, you know, and every time I see one, I'm here.
Me too.
You know, because you don't see it anymore much, you know, you see people they just swoop and go. So,
About 15 years ago, Melissa Mark Viverito had an event called the Poop Fairy Doesn't Live in East Harlem. And it attracted dog owners who were good about it, not the ones who really need that message. Maybe if you have an event where you give out free rolls of those plastic bags, maybe somebody could donate that to us
yeah, you know,
to help.
I'm sure CB11 can get a donation from somewhere to support a outreach ministry to distribute.
I'd be happy to participate in that and give information about advanced planning for your pets.
This is like pasta on this, but
Oh, I put spaghetti with meatballs and cheese.
Come on, you're making me hungry.
Oh, yes, sorry, I was waiting for you. I was gonna say with trash comes, you know, like dog owners and poop and then rats.
Yes.
Oh my God. We are feeding them.
Mhm.
They're huge. They no longer look like rats. They look like cats. And I have a cat. It is scary, disgusting, and not a quality of life for us human beings. What can we do? Can we have the rats, the mayor's office come and, you know, like come up with some type of solution or?
Well, you know, the mayor's
It's not
office has
working.
the commissioner of the rat dog.
Yeah, the green lady, yeah, I call her the
Yeah.
green lady. Yeah.
I mean, I know they do a lot of work in,
City Hall. Yes, I
Yeah.
know. I know.
I mean, and I know that they, have a committee, and the committee consists of different representatives from different city agencies where they supposed to collaboratively work together to, address problematic areas. What I don't know is how they get this information, like how do they determine what are they problematic areas? I know outside of someone just calling 311 saying we have this rat problem, what is the analysis that they're basing their execution on? Like, what is the committee doing to determine what the committee should be doing? You know what I'm saying? So I know that there's a committee, and I know that they meet because I know people on the committee. I just don't know how they come to their consensus to address particular areas. Again, the community board, Xavier and Angel should, you know, consult with the commissioner of, I think it's a DOT initiative, right? So that should be something that they should come and give a presentation on how they come up with their data, what are the statistics now, and what are the programs that they're using to combat it? Because it's a whole rat doll that the taxpayers' dollars are paying for. I mean, a significant amount of money. So we should be presented with a comprehensive presentation of how that includes Community Board 11, because it shouldn't be where we're sitting here asking about it. The rat doll has been in existence for a year.
It's interesting, there is definitely less. Well, I mean, I've been, maybe again, I don't live in the same neighborhood as, you know, everybody else, obviously, but there's less garbage being left on the street by buildings. At least in my neighborhood, because that's now a new requirement, you can't leave them out there on the street, there used to be piles of them by the garbage pails, you know, and that of course encourages the rats. So I've actually seen fewer rats on the street, I've seen more rats in the park. There's a lot of rats in Central Park, but I mean, the reality is, I mean, it's interesting, it's the third, I mean, it's a catch-all category, quality of life issues, but it's the third biggest priority in this sort of general think it's probably life issues. I mean, one of the things that's troubling to me is all these little things like dog and shit on the ground and the cleanliness of the streets and the noise and the bicycles or the mopeds on the sidewalk. They basically create this environment that this is a neighborhood that doesn't really matter and doesn't really actually something that even the residents are interested enough to actually take care of, which I don't think is entirely true.
Right.
But it definitely breeds that impression and it makes it much harder, in my opinion, to get a lot of other things done that require community support when everybody feels like they're living in a garbage dump. So I don't wanna oversell the importance of that when we have people who are with mental illness and homelessness issues, and we're talking about dog shit on the sidewalk. I mean, it's not the same, but it's emblematic, I think, of a larger problem.
Yes.
And that may be where we need to do some kind of awareness raising or help to rear rather than targeting, dog species. But the dog thing is just mystifying to me because no one comes and brings their dog to another neighborhood to leave their shit. Right, so these are people who live here. Aren't they bothered on their own streets?
I'm thinking about that when I see it in front of buildings, and like, if you live here.
Don't you live here? It's like, don't you step in it too, or you
But I
just
guess-
live on the radar?
Probably don't do it in front of your own building.
Yeah, maybe.
Yes.
Yeah.
Yes.
I have people in my building who go to the roof with their dogs.
Your roof, the
Mhm.
building of your roof.
The roof of my building, yeah,
Yeah, well, it's natural, I guess, I suspect that.
lazy.
Yes.
It's good fertilizer on cement.
Alright, let's see. Alright, yeah, any last thoughts on the quality of life? Any other spaghetti on the wall ideas about how we can, just begin to look at some of this stuff? I would love for us to look at homelessness in East Harlem a lot more seriously.
That's okay.
You wanna get it?
Yeah, I would love for us to really think about homelessness a lot more, strategically. Especially with respect to a lot of our newest New Yorkers. I guess, and maybe homelessness is looking more at immigration at the moment. I'm not sure if homelessness is impacting people even before, folks are coming in. So that is something that we need to be able to, address a lot more intentionally. Discuss, create opportunities for forums around, outreach strategies. I wonder, if they have, programs like, I'm sure they do, right, have programs like the Bridge for homelessness, right? Yeah, Al Johnson. definitely.
On brand.
Okay, then.
You're on the committee, right? You get to sit at the big table.
Thank you.
If you see this Carol Johnson, oh, yes, she found.
I see.
Tell me your name.
Alida?
Hi, Alita.
And Alita, pronounce your last name.
So we don't be over here.
No, but you guys have,
having-
just
we're
don't be
having,
scared, it's very
what do you
easy,
call it?
chikambu, it's just 3 sounds. That's it, chikambu,
Those that had it right.
yeah, don't think too hard about it, just chikambu,
I just threw it out there.
yeah.
Thank you for being here in person.
I tried, told you,
You're here.
it was not easy, but
You made it.
We made it. So we get her a budget thing. So we
Here,
want to take your photo. I don't know if there's any water in it.
it's just something, thank you so much.
All right, great. So, we were just talking about, some of the, results of the survey. And you'll see up there, before we turn to what's in front of you. These are some of from the 91 people who did fill out the survey in this community, these were the issues that were most pressing. Affordable housing, crime and public safety, homelessness. We see, quality of life issues, noise, graffiti, crime. We were just talking about, street cleaning, dog poop on the sidewalk, how this all, creates an environment that produces more garbage and disorder, and what is, how can we be more active in, getting the streets a lot more cleaner and having people to respect the community, especially, how can we be more targeted at the irresponsible dog owners who don't poop their dog or curb their dogs? things like that. So that's what we were just talking about before we got into our budget and stuff, just to bring you up to speed. All right, any last thoughts, comments, questions?
Just a quick comment to, we were saying about the, homelessness in the area. So like, we do work with individuals primarily who are homeless. We also work with individuals who spend most of their time on the street. A lot of them do have shelters, and they're supposed to be getting assistance with their 2010E applications that they can get their own place. But it's oftentimes very slow moving, at the shelters as well as at the safe havens. There are like a couple like peer-led agencies throughout the city that do help with 2010 applications, none of which are located in Manhattan, never mind this area. So, if there was more support with the 2010Es, that would speed up the process to get people into their own housing, which should have less people on the street. And then we're now at a point when it's starting to get cold, that the safe havens are starting to fill up. A lot of people choose to live on the street because they don't like the shelter system, they don't want to be around other people, they don't feel safe. They, think other people won't be safe with them around them. So people do prefer the safe havens, but those fill up quite quickly. So if there was more support on the supportive housing side of things, then that would, leave more beds available in safe havens, the shelters would be less crowded. And I think that would, help move people off the street in some regards.
When you say more support, what do you specifically mean? What dollars would be needed to provide that support?
Like some type of resource center where people can go and someone will sit down with them and walk them through like filling out the 2010 application.
And these resource centers exist elsewhere in the city, or they don't
Yeah.
exist in East Harlem?
Yeah.
We do?
We do.
Housing works doesn't.
And I guess it's more on the education side of things, because when I've contacted like CUCS, the resources they send me are none located here.
Not located in Manhattan.
Yeah, but they're
They'll apply for 2010E.
for like someone to, sit down and help them.
So housing works would help someone fill out the 2010.
We do.
Are there other organizations that also do this, or just housing works?
I surmise that there probably are other organizations that do it as well. I definitely know that we do that.
So maybe this is
But
what we
there
need to
should
do.
be, there should be
Well,
other organizations that.
Constantly resources, you guys should connect that way, then you have that resource now where there was a hole. I think connecting with the Connect program will help you build on that. That's helpful because you guys are both out there doing that. But this does, before I turn it over, this does make me think, and this could be a right now thing, but or a next year thing, but how do we have a request around services that, services supporting people obtaining into the applications and I don't know, what does that seem like something that should be advocated for? And if so, let's talk about that real quick. Yes, and Rose, I'm sorry. Please go ahead.
Yeah, I just wanted to say, so 2010E is a very specific type of application. So it's not like, I'm a single parent and, and I'm looking for housing. There's a mental health, that's part that's very important to that. And then also you need a specific accommodation. You need, like I said, it's a process. So you need to be involved with either a therapist, a psychologist, and the application itself also we go through different steps. I have a nonprofit and we do assist survivors who qualify for that. So it's not just like, it's not like the ultimate solution for homelessness, you see what I say, right? It's not, it's a way, but it's not, we need more affordable housing to combat homelessness. But 2010 is something very specific. It's not everybody that qualify for that. And also even for people who qualify, and then also, like you said, if you cannot go to shelter, the reason for that is that you're gonna have some assistance with your medication, for example, and, you know, it's not like you are not free, it's not your own apartment, you can have people over, so on and so forth. But there are some restrictions, and those restrictions are basically based on the person, what's good for the person. So that's what it's more than just like a housing option, what I wanted to say. And like you said, our organization supervising is in the community. I know they do that too. We do that, you did not know, but it depends on the type of the person that we serve. So like definitely education, that's what's needed. But I would like to say, don't think about it just like the way out, just to have with homelessness, because it's more than that. It's more complicated.
Of course, I think that is just one component, especially because a lot of people who are spending most of the time on the street do have mental health and substance use and co-occurring disorders.
Yeah, but it's very much like the person needs to be involved with the organization. It might take long, you know, it's like, again, and because after the intake and everything is done, and even if the person qualified, it's also about the availability, you know, and then in what type of setting the person will be, it's very complicated. Yeah, but it's doable.
Can I ask a question, just for my own clarity? So with the 2010E, that is just to help you to get in supportive housing, or is it for both supportive and?
It's 40,000. That's what it is. It's, yeah.
That's what it is.
Yeah, it's really for that. It's really what's 40,000.
Could y'all all connect, please?
Yeah, I will give him my
Please,
call.
yes, please. He needs to learn resources. Yeah, all of that. Please, yes. After we finish this convo, we'll move into where we came from. But no, this is good. No, this.
Antonika, do you, you mentioned that you guys also do housing, right? Do you, help individuals with FHEPS vouchers?
FEPS.
Yeah, I couldn't.
It's hard, FEPS vouchers are tough, but yes, we do have clients that have FEPS vouchers. The issue with that again is landlords accepting them. Like,
I have a connection, but I don't wanna be in the middle. So I need someone else to help me for, you know, because I help a lot, but I just want somebody else to.
right. Yeah.
Okay, thank you so much.
All right, any other close questions here? All right, cool. So let's pull out our, thank you, Marlon, we gonna. All right, so, all right, I wanted, if we all can manage this, let's try to get out of there by 8 o'clock, if that's a reasonable time.
Reasonable.
Reasonable, great. All right, so we're gonna, what we're gonna do is, walk through the budget priorities. After we've read all of them, then we will come back through and rank them. There are some old ones that were redrafted. I'll go through those and I'll let Jen go through the ones that were new additions. What I won't do is go through what was taken out, because you can see it in the back of your document. You will see 3 highlighted that look sort of like this. Those were taken out. And the reason they were taken out was because we believe we can advocate for this resource in a different way. Actually, the community, us as a committee, can just be a little bit more proactive in some things that may help. So we just want to strengthen the pack of budget requests we put out. So we can start with the first one. I'll let Jen go. We can go ahead.
Yeah, so the first one is funding to address violence. So I'll just read it in case I haven't got a chance to, which you probably haven't, since I just finished this right before the meeting. But funding is needed for violence intervention programs, including programs to address domestic violence, community violence, and gun violence. According to the NYPD, East Harlem has a violence crime rate of 10.3, and that should be violent crime rate. I mean, like 10.3, nearly double the Manhattan and citywide averages. 5.5 and 5.3 respectively, in the last report released by the mayor's office to end domestic and gender-based violence. East Harlem had the highest rates of intimate partner violence across New York City. Regarding gun violence, a recent study found that 35% of surveyed high school students in East Harlem reported personally witnessing gun violence. Programs must address gun violence as a health crisis and invest in evidence-based public health interventions. Overarching violence prevention programs, including the hiring of additional violence interrupters, creating hospital-based violence intervention programs, developing mechanisms to better identify people at risk for gun violence, and providing education on safe gun usage and storage is needed to ensure a safe community. Just as a note, the reason for all of the research is because they often come back saying there's not any research. So we're hoping if we provide them with their research,
Hold on.
I mean, they'll probably still come back with something, but at least we.
Yeah. So another thing is, Marlene pointed out something, who is this? Well, one, we should look at the reference guide so we know, because the asks have to be very specific. So like, how like number 2, other programs to address public health issues requests. I think this is probably the same thing, other programs to address public health issues. And it sounds like this is going to DOHMH. Is that what you had in mind? Or?
I wasn't for the agency ones, I get confused, so I figured we would just discuss it, because there's.
So this doesn't sound like DOHMH, it sounds like a public safety thing, which is usually under the purview of the Public Safety and Transportation Committee. Not this committee. But it's been done in the past where a committee has created a new request and handed it over to the appropriate committee. Like, for example, this committee, Parks had created a request that was more specific to human services, so it got tagged as a new one that year, whatever year that was, maybe it was 21 or something like that. Did you get this? So you didn't get this from the request language? You didn't get this from the guide? From the reference guide?
Yeah.
Okay, so the funding to address violence, that's from you?
Yes.
Okay, all right, so. If you want to keep this and hand this over to public safety, what you have to do on the floor tonight is go through this reference guide, probably go to NYPD. And see where that would fit.
So I don't think we want to ask the police for the program. I think we would want to ask. I was thinking it'd be maybe DYCD.
Yeah, I was thinking of violence more as like a public health issue,
Yeah,
of
so-
like, domestic
Yeah.
violence isn't really public safety as much in the home.
DYCD would be you.
That's just you.
That-
Yeah, that's
It still wouldn't be this committee.
Yeah, so, but I don't wanna go to the police, so that's not that, I'm just saying, like, so what agency would we, cause I was initially, this I was thinking was HRA and DOHMH, but.
Department of Health,
Department of Health?
that they could,
Department of Health?
do a program.
As a public health, this is a public.
Well, you got several things, and there's several city
Yeah.
agencies in this
Yes,
whole paragraph.
that's what I'm trying
Like, there's
to
several of them.
help you guys see.
Okay, so what does it make sense to do now, like, focus it in on one agency or pick it apart, like, what makes the most sense for this?
Cause the stat here specifically says according to NYPD. And then you move down and you go to the mayor's office to end domestic violence. That might fall under HRA, you have to go into the reference guide and pull that funding language to see if it fits.
You also mentioned the hospitals, like creating hospital-based violence intervention program, which is Department of Health.
That could go to, the hospitals, literally the hospitals, so,
Hospitals.
it's right up here, it's Health and Hospitals Corporation, HHC. So you would go there and then look at the guide to see what language fits with your request, but you have 3 different requests in here.
Yeah.
Which is fine, on the floor, you guys can suss this out. To see what you wanna pull or send to another committee.
Okay, so-
Like I said, it's been precedented that one committee sends something to another committee.
So, I think I should read, I found, this actually is helpful, I found, so for HRA, that's that agency, so this is DHS, for HRA. we do have domestic violence services. So you also have, so you have under that, the request types are, so the need is domestic violence services, the request types is provide emergency shelter for domestic violence victims, expense, provide social services for domestic violence survivors, legal services, counseling, referral to supportive services. And then you also have other domestic violence services requests. So it could fit under that, right? Violence, what, we're talking about violence prevention. Yeah,
Yes.
like intimate partner violence, that could fall under this one. If you wanted to take that out from the gun violence.
Say that one more time, sorry, I was busy working with my.
So I was looking at that one, and I think it's the next page, actually. No, it's not.
Okay.
It's that one. So that one up there, the second one that says, I was reading the needs and then the request types for that need for domestic violence services. And it does say,
Provide emergency, no, provide social services for
yeah,
domestic violence survivors,
yeah.
okay. Okay,
But that would also mean that we're picking apart that one, right?
yeah, you would have to take this out, you would have to find it and take it out and then make it a new.
So that's one aspect of this. Could we, what was the second aspect of it? It was gun violence specifically.
Yeah, I was gonna say,
Go ahead.
we have to do the prevention, not we skipping over why it's domestic violence. We have to get to prevent the domestic violence. I mean, not to say that I mean, I have unfortunately way too much experience with gun violence. And then on the 23rd, I was at the tail end in the middle of a shootout on my block at my building. Where I was standing on the corner and these two people, I live in a Riverton complex, and which historically is never violent, like never. If two squirrels are fighting, that's as much violence as we get in the complex. And this day, it was 5:30 in the afternoon, and we have a senior center and Boy Scouts and children were there after school playing. And two guys got into an argument inside of the complex, which usually never happens. And the argument was one wanted to shoot and the other one didn't. And by the time they finally decided to start shooting at each other, they not only started shooting at each other in the complex with all of these kids inside, they ran out to Madison Avenue and was running towards me, and the bullet went right past my face and hit the stop sign that I was standing next to, and literally like the angels and ancestors, I just froze. I couldn't even move because I felt like if I did, I was gonna run into a bullet. So they were chasing each other down the street and the bullets was just going right past me. To when they finally stopped because they kept missing each other, I was able to dive under a car, so now I'm under the car. And the person ran in my building, so I couldn't even go in the building because he ran in the building. Then the people that he ran past in the building, he apologized to them for shooting, said, "I'm sorry," and ran up the staircase. And this is what people are so comfortable now in our community. I'm sorry that I'm not. But I think when I say prevention is because I don't think that there's sufficient consequences. So my cafe is right next to the 32nd precinct. And I see people going arrested in the morning and they out. All day. And I don't think that there's sufficient enough gun activity laws to prevent people from even acting on having a gun. So you have gun violence that's into domestic violence. Now we're just dealing with the people that's getting domestic violence. What about the people that's causing the domestic violence? Or circumstances that I experienced the other day. Wow.
First off, I'm sorry that you had to experience that. Thank you for sharing that, because yeah, I can't imagine. Yeah, there's levels of apologies I'm gonna give.
That's okay.
It's not on my back.
Yeah.
Give you apologies, but one of the things I do want to do though, just for the sake of the conversation, we do have to very specifically separate gun violence from domestic violence. Specifically because, you know, you don't need a gun to,
Yeah.
you know, that just happens based on the home inside conditions. You actually need to get a gun. I think the prevention is how guns are getting in. These are like more common. So, but I don't want to go there. But I do want to split this up into the parts, like if there is a part of this that maybe the gun violence portion, maybe our niece, you can help us draft that and we can pass that over to public safety, if that feels good. And let's talk about that, and let's actually use an example of, you know, signing up for the innocent bystanders. During, you know, there's some statistics about that we can, you know, use to strengthen something around gun violence prevention. Keeping, I think in the illusion should be around keeping guns out of the hands of people. You know, not just so much punishing, but how they just keep it out of their hands in the first place, and things like that. Yes.
I'm sorry. Again, this is this is new to me, and if I may, I agree that we should have some type of separation between DV and gun violence, but one thing that we have been saying, and the reason why this paragraph makes sense to somebody like me, is that there is an increase in domestic violence crime, and this is due to gun violence.
Okay.
And so not to see them totally separate, but domestic violence exists in many forms, but now we see more death because of the gun violence. And the fact that, like you said, we don't know who have guns, people have guns, and whatever use they're doing of it is costing people's lives. And domestic violence being already a major issue as it is, you know, in our community, in the city, everywhere, this is getting very, very complicated.
Yeah.
With this gun violence, is part of it. So I don't know how we're going to make it, but let's not, the fact that we can really show that into a section, intersection, and the way it's linked, it gives more power to why we should pay attention to DV.
So I saw something in here under services for vulnerable New Yorkers, and I wonder if that's a place where we could.
I was thinking the same thing.
You know, that's a place where we can. And I don't, because I don't want it to sound condescending. I mean, of course, we can say young people are vulnerable, but, you know, I don't.
In a population where guns are prevalent, people without guns are vulnerable.
Okay. Okay. So, Marlene, you think this could fly? If we are.
As long as you use this exact language. Just choose one.
All right, yeah, so we have to strengthen this one.
Like Olympian
All right,
athletics to figure this out.
so can I just get clear on this one real quick? So we are, and Jen, please weigh in on this one. But so it sounds like what we're doing is connecting, domestic violence and gun violence, just violence, period. It sounds like violence prevention. And maybe we don't need to articulate what types of violence, if you don't want it to be flagged for like it should go other way, but like violence. And just like articulated around violence and how, and maybe using examples of gun violence and partner violence as the types of violence. Maybe, and so what are we asking for? More programming around violence prevention? More strategies for avoiding, preventing violence, and what exactly are we asking?
We need definitely more prevention, but also we need to more accountability also for the community and even for perpetrators.
The accountability argument would be public safety. So,
But I'm also, I'm really strongly thinking we should devise the ask from the Human Services Committee. I think we could put it together and it comes from us. I don't think
okay,
we should.
okay. Okay.
Because if we give it to public safety and they have, a list of priorities, you know what I'm saying, like they might have a.
Yeah, that's the fear I have of giving any committee, what we take as important, because they might not see that as a priority, and we might go behind the list of priorities.
The challenge though is that if we're using this language of services for vulnerable New Yorkers, assuming that vulnerable doesn't mean something within the city budget structure already, because I think it probably does have a meaning that isn't just as broad as vulnerable, but nevertheless, that's the services for the people who are the potential victims of this, not the services for the people to keep the guns out of the hands of the perpetrators. Right, so I mean, what are the services we're looking to provide to people? We're not certainly gonna arm them so that they're no longer vulnerable in the face of the people who have the guns.
When you say vulnerable, you're usually talking about protection.
Right.
Putting protection in place.
Right, but what is that what is it we actually want to fund?
If there's, where it says domestic violence services, there's one little quote that says, provide social services for domestic violence survivors, like legal services, counseling, referral to supportive services, etc. We can expand.
We can expand on that.
Yeah.
Because education too, yes, you're a victim, but what can you do so it doesn't happen to you again?
And I also think to that point, the gun violence could fall under, services for vulnerable, like, this, and the services programming around, you know, gun violence or gun awareness or things that can lead to, you know, at least people being prepared in the face of a gun. Some even things to the extent, like sometimes people find guns in their house and their kids have brought home, stuff like that, they don't know what to do with it, like, so maybe gun education, I don't know. But some sort of preventative, because that's what it sounds like, and please weigh in there. I'm trying to get us clear, right, that this is not one that we're gonna work on today. We at least need to walk out of the meeting understanding what we plan on articulating, so that who are gonna be working on it have a clear sense of where we're going.
Marcel has her hand up.
Hello, Marcel.
Hi, good evening, everyone. Apologies for not being there in person. But I wanted to piggyback off something that Isaac, I believe you were speaking. You mentioned education. I think that would be very important in addition to providing maybe services on how to properly store guns, because realistically, yes, we have to acknowledge the fact that people do have guns in their homes, but to keep them out of the hands of children and those who we don't want to have access to them, I don't know, perhaps offering some type of service where they can learn how to properly store guns so that it's only accessible to those who know how to properly use them. I don't know if that's something that's considered. And also for those who are acting out violently, perhaps providing some type of anger services for them. If prevention is key, what can we do to avoid them picking up the guns in the first place, giving them ways to properly give them the proper outlets for all that anger and frustration, mediation tools or something of that nature. I don't know where that falls, but that's just something that comes into mind for me.
Yes, thank you, Marcel. Behavioral health programs and programs to help us anger management, things like that. Thank you. Okay, so it sounds like we understand how we want to attack the gun violence, am I correct? With this lens of programming around anger management and also programming around de-escalation, but also the gun education. Okay. So this again, so are we doing this to HRA under services for vulnerable New Yorkers? Or, yeah. Forget me, Isaac, you decide.
No,
That's how I take crickets.
I think so.
That's how I take crickets.
That's CCP's language.
If
and
it's,
that's what
if,
the-
I think if it's domestic violence, then it should be healthcare and human services, and we shouldn't include gun violence.
Okay, so two then, we have
Yes.
two in making.
Yeah.
Great. So, okay, so one is specific domestic violence, okay, and then the other one is specific gun violence. Maybe gun violence, maybe young with an emphasis on young people. Just like the programs we can outline can be for young people in this regard, behavioral health programs, supporting families with troubled youth or things like that.
I actually brought that right up.
Huh?
I don't wanna die from gun violence, I'm not a youth, so I think.
Yeah.
I think the gun violence should be open to everyone, yeah.
We should also.
I think we can include that, like include youth, if you wanna get. Well, when they're young and,
Yeah,
but I don't think gun violence like discriminates against only youth.
right.
I guess what I was saying was that the programs were sent specific to young people, but it don't have to be, they can just be programs that are anti like, anger management, behavior health. It's improving general, just for all,
So we've broken out into two.
yeah, one is DV and one is violence. That's cool.
So you wanna start crafting the first one now? It has to be done
Sure,
tonight.
we can. It's not even fun. We don't have to make it.
So I go through the others and I can work on that and we can revisit it.
Perfect, yeah. You have, you want to record? Yeah,
Yeah, and I fixed all the other ones, so.
all right, cool.
So,
Oh, okay, great, perfect. All right, yeah, so. Thank you for the discussion on that. Second one, let's go to the second one on this page. We're going back there. Jenny's gonna craft, she's gonna work
Thank you,
on
Jen.
number one while we go through the rest of these. So the second one, was a request of the program to address public health issues request, and the request was strengthened. And I'm gonna only read the redrafted explanation, and if there are no, like, if there are no critiques about it or anything like that, I will just move on to the next one. So I'm not gonna spend more time. So redrafted explanation, East Harlem has one of the highest drug overdose rates in New York City at 56 per 1,000 residents compared to the citywide average of 21.2 per 1,000, according to the City Department of Health. Increased peer support workers and social workers in high-risk areas such as the 103rd, 110th, 116th, and 125th Street corridors are essential for connecting at-risk populations to treatment. Peer support interventions shown to improve recovery outcomes. And this is by the National Institute for Drug Abuse, will play a critical role in street-level intervention, reducing drug-related crime and barriers to seeking help. But this is just more outreach to people in the streets. Any thoughts, comments, anything? I'm gonna go on to the next.
Are you going back?
Yeah, we're gonna come back to rank them. I want everyone to have read every, we have them all, then we'll go back and we'll just rank them.
Okay, they're gonna have it remembered?
No,
No, I think we should
No,
rank
I
them
mean-
as we go, so we don't forget.
That's up to Isaac.
the reason I'm saying that is because you don't have a reference to rank them.
Once you hear them all.
Once you hear them all, you'll have a reference to say whether it's a high priority or a low priority. If not, you'll rank everything high, and then we'll have to go back and then.
We may learn about that.
Re-rank everything.
Okay, that's the point.
So, number three, do you want to skip three, so you can, that's a new one.
It should be good.
Oh, it should be good, okay.
So I changed it to. The request to provide expand or enhance food assistance such as food stamps / SNAP. So disregard what's written there for the request, but the explanation is still the same. There's a growing number of East Harlem residents who are food insecure or lack access to basic healthy foods. This has been exacerbated by the rising cost of groceries, delays in SNAP recipients receiving benefits, and the closure of supermarkets within the district. 13.5% of respondents to the public input survey identified access to healthy food and lifestyle programs as their most important healthcare and human services related issue, according to the DOH data. East Harlem has a 1:17 ratio of supermarkets to bodegas, the second highest in Manhattan. Furthermore, according to the East Harlem Community Health Profiles, 18% of East Harlem residents do not eat at least one serving of fruit or vegetables per day, compared to 10% overall in Manhattan. And 30% drink at least one sugary beverage. So we need an ask here, I don't think.
Yeah, I was gonna say, what is the ask?
Jennifer, I'm also gonna change highest to lowest, because if you're gonna do
Yeah,
ratio
it's
number 17, it's actually lower.
The ask is the request.
The ask is the request.
It's always the
Yeah,
request.
so
Your
that's, this is
explanation
just the
doesn't have to
explanation.
end in a question mark. You asked up there when you requested it.
Yeah.
So, Jen? You went to HRA for this?
For
The
what?
agency would be HRA?
Okay, yes,
I'm asking.
it does say services to support
Yeah.
low-income New Yorkers.
Where it says, okay, services for low income New Yorkers, and you're taking it from provide, expand, or enhance food assistance such as food stamps / SNAP.
Yeah.
That's it?
That's great.
All right, any objections or can we move on? All right, number 4, redrafted explanation. The request is other senior center programs request. East Harlem's growing senior population requires expanded services and culturally appropriate care. We request increased funding for bilingual caseworkers and in-home caseworkers and translators who can assist in navigating medical, legal, and housing challenges. Additionally, funding should support culturally sensitive programs, including meals, English language classes, and wellness activities. By providing seniors with tailored support, we will promote aging in place and improve quality of life for one of the most vulnerable populations in our district. I'll move on. Number 6. Number 5, sorry. Other programs to address public health issues. And I'm sorry, that last one was going to DIFTA, the Department of Aging, in case you were wondering. This one, other programs to address public health issues requests. This is going to DOHMH. Redrafted explanation for the request is East Harlem has experienced a rise in hazardous waste, including discarded hypodermic needles around treatment facilities, creating serious public health issues. According to the NYC Department of Health, improper disposal of needles significantly increases the risk of needle stick injuries and the spread of infectious diseases like HIV and hepatitis C. We request funding for a dedicated team to regularly monitor and clean the perimeters of these facilities, ensuring safe disposal of drug paraphernalia. These efforts will protect residents and workers, promoting a safer and cleaner environment around essential healthcare services. Needle outreach.
Is that's not the Department of Mental Health and Hygiene?
That is DOH.
Oh,
Yes,
okay.
that is DOH.
Okay.
I have a question.
Yes.
Well, question, comment. In addition to the around those facilities, I've noticed an increase of needles in around public transit places, like the train station and the subways. So if we were to bring that up, does that go to MTA or does it go to the same department? Because a lot of the users hang out around the subways.
Well, I think it should be the Department of Mental Health and Hygiene primarily because they give the training or they are equipped medically to deal with hypodermic needles which contain bodily fluids. So I think it still would be them.
Okay.
And then they in turn would give the MTA workers their training.
We say around treatment facilities in adjacent, like
Like public spaces,
properties also.
adjacent public spaces.
In adjacent public spaces, okay.
Yes.
Can we add that? I don't have my computer. I'm
Thank
sorry.
you.
That is number 5. The redrafted, so it would be around treatment facilities and adjacent public spaces.
There's a question.
Yes.
It's just a very good comment, because the On Point does do, like every single day, they go out to areas and some of, a lot of the hotspots are pretty clean from what I see, but if you do let them know of other areas where there are needles, they will add that to their list.
Okay, thank you. So can we make a note to reach out to On Point about some of the, like Marcel, when you see stuff like that, can we like snap a picture of it and then we can, reach out to, On Point, in in the interim, so they can, you know, maybe they may not be aware of certain locations.
Absolutely. I mean, out 116 train station, 456, 4 and 5 train. There's a lot of presence of, users, but I'll definitely keep an eye out of other train stations. I know 125th Street as well, but thank you. I'll be sure to do that.
All right, thank you, Jen. Okay, so, any other thoughts before we go to number 6?
Just quickly, I'm sorry, I had my hand up.
Oh, sorry.
It's all right. Just I wanted to emphasize that a lot of what was happening on 125th, I'm not saying 125th is perfect now. It has moved down, and especially under the bridge on 116th Street is where a lot of needles are. So I think that there needs to be some sort of cleanup over there happening regularly, especially with the construction happening at La Marqueta. So
But thanks for that, Ash, because that's exactly what's happening. The building on 125th Street is pushing stuff down this way now. You know, that's what we've been seeing a lot lately. All right, any other thoughts before we move on? Comments? I appreciate you both. This is great. All right, so number 6, increased case management capacity. I believe this was one we said we needed to get clear on case managers where, but it is a different thing. This was one going to the Department of Agents, so maybe as I read it, if it still needs to be clarified, we can just add a word or two to clarify. But we drafted explanation for the request of increased case management capacity. East Harlem's diverse population includes many residents who primarily speak Spanish or French Creole, necessitating an increase in multilingual caseworkers to address social service needs. According to the New York City Department of City Planning, 35% of East Harlem residents speak Spanish as their primary language, and a growing number of French Creole. Culturally competent caseworkers are vital for helping residents assess housing, healthcare, and employment services. We request funding to expand caseworker availability to meet the linguistic and cultural needs of the community, ensuring no resident is excluded due to language barriers.
So I thought it was redundant to number 4, but you're asking us to do different things.
It could be. No, it could be. I
Well,
remember you
what-
saying.
Number 4 was senior centers,
Yeah.
but when you're talking about case management, that's not necessarily what senior centers do.
Okay, yeah, so should we, so does it? Does the need for this request change to HRA instead, or do we not need to request?
No, this is still DIFTA.
Still different.
This is still DIFTA.
Okay.
Why is it not? Why is it
HRA?
different? Why is,
Department of the Aging, they
why,
run.
what if it's somebody that's not aging? Like, it doesn't have to be.
Oh, okay, I'm sorry, I was thinking of,
No, yeah, this is still
Significant.
good because, a lot of, populations that we serve, they speak a lot of languages, not just French and Creole.
No, I'm just saying they're
You
not
know?
just seniors is what I'm
Right.
saying.
No,
So it doesn't have to be
definitely,
Department of
definitely.
Aging.
Send this request to multiple, or
so where would it
agencies?
go?
I'm sorry.
Can we send this request to multiple agencies?
Yeah, you just have to create new ones,
Just a.
new requests.
Okay.
So if you want to, you also have to look at what agency are you sending to. Do you want to send this to, you have to see where it fits
Okay.
with DCP.
But can you find something, I think also Asher, youth and education needs this also, because youth and education can,
Oh.
because there's a lot of people
What were sent,
in the education
there's language
system
for it.
that they don't speak.
So,
And
this
me
was
as a
like-
Spanish
I'm
teacher,
sorry, I cannot hear Rosa.
Same.
sorry.
So go ahead.
No, I was gonna say that, a lot of parents and guardians, they don't speak English. They speak other languages like Urdu and Wolof and any other language, and like the DOE, sometimes they don't have these services, and I think the Youth and Education Committee can also benefit from this drafted explanation.
around.
It is a need
Language.
about language
I
barrier.
think so. What it sounds like, Asha, is that you all need to create a educational specific language barrier request. One that's geared towards education.
And I would
I
say,
guess we all, because I'm on that committee.
yeah, but I would say whoever's gonna draft it, don't leave room for them to say it exists through 311. So.
There is no.
But what I'm telling you is
Yeah,
just make sure you prepare yourself in your request to say, this, we're asking it because this that exists doesn't serve this purpose, so you don't give them room to say, what exists there, and then they're not gonna answer you for another year.
So can I just make a request really quick? So can we just duplicate this one? One can just say, our Asian, populations include many residents, blah, blah, blah. And then we have one that's just straight language like this, but goes to HRA on the services for vulnerable youths. And, I will find a new now. Yeah, other requests, other requests in this language. It's here on the.
So you're in this for now? And the request is increase state management capacity. Right, everything to the base management capacity. And then
Yes,
from
please.
there, whenever this was
So
created,
with these requests that
they
you are
made this fit
submitting.
this
are
request,
these
but you
things that
guys are
you're
saying that you
then,
want to change it this year.
collaborating with
fine.
other
You can do
community
that. This was created in
organizations to
March
do,
2019.
or like,
So that is a good question. That is a whole.
just because you're using the phrase case management, it's like, so is that what you guys are gonna do? You're gonna hire case managers, or you gonna?
No, we're asking
partner and
HRA,
collaborate.
we're asking the city to give the city agencies more money to do these things.
Got it,
Yeah,
okay.
so that that's
Like
why
a
all of
grant.
these requests are, so, they're funding city agencies up to a certain amount, whatever, so we're just asking, hey, give money specifically to this agency so they can do more of this in our community.
Got it.
Yeah. There was something I wanted to say. Oh, to your question, the beginning part of that. There are some things that we are moving off of this because we can work in collaboration in some ways to sort of get to these things. And that's what we want to do. We don't want to cloud up the blood. We don't want to crowd this up and clog it up with stuff that we can be doing ourselves. So that's part of the shift in what we.
Understood.
Yeah. Thank you for that question.
Yeah,
It's
it
good that
just
that's
made
on
me
the
think,
record.
because this morning, my colleague and I, we collaborated together at the Family Wellness Week and did an activity for, the Spanish speaking mothers who are in this support group, and, that's what we did the sex education, sort of like one-on-one introduction, and also the introduction to wellness overall. But it was like, through that collaboration, we see that as an opportunity to come back, like a monthly thing, so that's what I was trying to figure out where.
Okay. All right, so is that cool? Do we do 2 of them? Okay, so, Marlene, that's the language. I don't know if we're gonna kind of do it.
I'm gonna do it now, and I need you to speak slow, clear, and concise.
We can just duplicate it on the sheet for you and just.
Okay,
change
if
it
you
one
could
word.
do it that way, I'm gonna have to see it before we leave this meeting. Okay?
You have your document.
I can't, cause I'm sharing.
Okay, you share.
Yeah.
Oh, okay. So
So
it's literally gonna be the same one, no.
it's okay,
let me
I'll
not say that.
sit with you guys after the meeting, just to look,
All right, I'll do.
cause I have to bring this to board office tomorrow.
So the consensus is that we're going to duplicate this one about language. One is going to be specifically for Asian population going to DIFTA, and one is going to be general, going to HRA for everything. Is that correct?
Yes, no one is good.
Well, let's keep it moving. Number 7, promote vaccinations and immunizations. That's the request. We drafted explanation. East Harlem has historically lower vaccination rates compared to other neighborhoods in Manhattan, particularly among marginalized populations. This puts the community at risk with, This puts the community at increased risk of outbreaks of preventable diseases. To address this, we request targeted funding to expand vaccine-related outreach, engagement, and access, particularly.
That was a battle.
We're just talking about.
I'm vaccinated, totally. Sorry about that.
As if we
Good
need
example,
that.
good example.
Hey, thanks, Mark. You wanna finish your?
No.
Oh, dear.
So to address this, we request targeted funding to expand vaccine-related outreach, engagement, and access, particularly for I have to get that. Let's see. Particularly for underserved and high-risk populations. This initiative should focus on building trust in vaccines, providing multilingual and cultural competent communication, and improving access to vaccination sites, expanding outreach through mobile health clinics and partnerships with local community organizations can help increase immunization rates, protect public health, and prevent avoidable healthcare costs associated with vaccine preventable diseases. Long explanation. I feel like you tried to undercut all of their responses to it kind of way. But if that's cool, I'll keep going. That's going to DOHMH. Sorry. Next request, animal and pest control requests, including reducing rat and mosquito populations. Self-explanatory. Do I need to read this?
No.
Yeah, we're all the rats and
So who does it go to?
the rats and mosquitoes. Say that again?
Who does it go to?
That one does go to,
Oh, it's
Say it right there at the bottom of
sorry, it does go to
Sorry.
DOHMH.
Thank you.
Yeah, and actually, last time Pauline was here, she gave us updates on the mosquito spray and folks were asking questions about it. All right, so number 9 is allocate funds for outreach services to homebound older adults and for programs that allow the elderly to age in place. We drafted request, explanation, that's what I should say. We drafted explanation. East Harlem's aging population and residents with disabilities are particularly vulnerable, with many requiring assistance to transition from hospital or rehab facilities back to their homes. According to the New York City Department for the Aging, over 16% of East Harlem's population is 65% or older, and many face challenges in accessing necessary care. Excuse me. Additionally, 12 to 15% of the East Harlem population has a reported disability according to city data. We request additional funding to expand outreach services for homebound older adults and people with disabilities, as well as programs that facilitate aging in place. This includes faster service transitions from hospitals to home care, along with in-home care meals, delivery, and social services. These programs will reduce hospital remissions rates, and ensures that residents have the resources and support needed to maintain their independence and live safely at home. I wrote this stuff too.
Good job.
I'm sorry, just tripping on my own words. Any objections to this? Thoughts is that, I'm gonna flag this against my better judgment. But it does mention disabilities in the same place as aging. So are we okay with sending this full request to DICTA right now? Do we feel like it should be split? It doesn't have to be split if, okay, my hesitancy is time, but what do you guys think we should do?
What would be the other organization besides DICTA?
Good question.
I don't know.
Okay.
I think there's a Department of Disability Services that I think.
We got them on now. Do we get them too?
No.
DSS?
That's,
No, we do Department of Social Services. Is that-
yeah, social, DSS has HRA,
Oh, yeah.
just underneath its purview,
There's somebody-
DHS.
That wouldn't just be an HRA?
We can check that.
Yeah.
Let's check together.
Yeah.
So you're looking for,
Department of Disability.
I got it, but I'm looking for, under HRA, like language that would fit the disability underneath HRA.
If the goal was to split it up, yes. And I think that may be vulnerable New Yorkers as well. They would easily fall into that. I don't know if there's one specific. Oh, services for, oh, no.
It says.
No,
it's planned-
well, they have, well, hold on, I'm sorry. So the need, we already had it listed as, I think the need could just be, services for homebound older adults, but then it wouldn't resolve for children. That was a difficulty, that's also. Yeah, I mean, it could go into vulnerable adults.
But what happens, sorry,
Please.
but what happens when, that elderly person doesn't have Medicaid? What happens when they don't have papers in this country? So what are we doing then? Because that's what basically happened to my dad, you know, like cancer, in and out of the hospital, in and out of rehab, and, you know, didn't have Medicaid.
I think that was part of the case, would that be part of the increased case management capacity?
It depends. Most agencies are not prepared to deal with immigrant status documentation.
That's why I want to really focus on. Do we have a new?
Because while we may know how to get somebody from hospital to home, we don't know how to serve that person legally.
Okay, so number 11 is actually on immigration, so maybe that.
And if they don't have
access.
health paper, Medicaid,
Right.
you know, because while my dad is, what was I finished for impact? His Medicaid, they kept on cutting him off because, you know, he has cancer, he's about to die, so they didn't care. So like, what happens then? We asking the city agencies to provide funding for this organization where they're not servicing our elderly anyways. You know what I mean?
Which is why these things need to be from the commissioner level being held accountable for these things, because they keep skirting behind their staff that keep recycling these answers to us every year, and it's them making a
It is
decision.
recycling answers, you're right.
They do that.
Yeah.
I mean, I witnessed it. I unfortunately participated in it. I mean, from a rebellious standpoint.
Of course. No other way.
We gotta do what we gotta do.
Yeah,
best.
but
So yes, the way you have worded this request, it said older adults, it is different.
Okay, so let's leave it like that.
yeah,
It's not complicated. Let's move on to number 10 and 11, because those are new. And whenever you're ready, then we'll get a second.
So for 10, this is now other requests for services for vulnerable New Yorkers.
HRA again.
Yes. There's an urgent need for funding to expand and enhance services for LGBTQ plus. For the LGBTQ plus community in East Harlem, a community where cases unique challenges related to health disparities, discrimination, and violence, according to a 2022 report by the comptroller. East Harlem has one of the highest rates of anti-LGBTQ plus hate crimes in the city. In addition, a survey conducted by the NYC Anti-Violence Project found that LGBTQ plus youth in East Harlem are more likely to experience homelessness and violence than their peers elsewhere in Manhattan, with 40% of respondents reporting housing insecurity and 25% reporting violence based on their gender identity or sexual orientation. Substance use disorders are also disproportionately high within LGBTQ plus communities due to compounding effects of stigma, discrimination, and mental health challenges. Addressing substance use through targeted mental health services and additional recovery programs must be a key component of any LGBTQ plus support strategy. Services are critically needed, including mental health support, legal services, housing assistance for at-risk LGBT plus individuals, and substance use interventions. Funding should prioritize expanding trauma-informed care, providing culturally competent healthcare, and increasing access to emergency shelters. Additionally, education awareness campaigns aimed at reducing discrimination and hate crimes must be integrated into community safety strategies. Developing treatment partnerships existing LGBTQ plus organizations will be crucial in addressing the specific needs of this community. And then for 11, we have another request, change it to another request for services for vulnerable New Yorkers, again to HRA. East Harlem has a significant increase in the arrival of migrants, particularly asylum seekers from Latin America, Africa, and the Caribbean. According to the Department of Social Services. East Harlem has been one of the neighborhoods most impacted due to a high proportion of immigrants and its existing shelter and service infrastructure. The community has seen a dramatic rise in Venezuelan, Honduran, and Haitian asylum seekers, many of whom arrive with limited resources and face difficulty in accessing housing, healthcare, and employment. Migrants arriving in East Harlem face multiple barriers, including language difficulties, a lack of legal representation, and limited access to social services, according to the mayor's office. 30% of East Harlem's population is foreign-born, with a growing number of undocumented individuals and asylum seekers. This shelter system in the neighborhood is overwhelmed with more migrants in need of housing, legal support for asylum applications, and healthcare services, including trauma-informed care for those fleeing violence or persecution. Funding is urgently needed to expand housing assistance, legal aid, and healthcare services for migrants in East Harlem. Programs should prioritize language access services, mental health care, and pathways to work authorization, addressing the specific needs of asylum seekers. Collaboration with organizations should be expanded to provide target outreach and comprehensive support. Additionally, funding should support vocational training and ESL programs to help migrants integrate and find employment. And then we have two that are not on there to be added. The other request for services, this one is about gun violence, and it's not me.
Yes, please.
I'll read this slowly.
Now, what is it? So it's gonna be Marlene, it's on the paper, we're gonna read it now. And then we'll vote on it, but it's on the paper, all right.
No, it's okay. I'm gonna sit with Jen or who, either one of you. I can listen. Okay.
We have gun violence is a public health crisis in East Harlem. And this is other requests for vulnerable New Yorkers.
We're gonna also go to HRA.
Yes.
Got it.
Gun violence is a public health crisis in East Harlem, where recent data shows the community is disproportionately affected. A study found that 35% of surveyed high school students in East Harlem have personally witnessed gun violence. To address this crisis, funding is needed for comprehensive evidence-based interventions. These programs should include violence prevention for at-risk youth, hiring addiction violence interrupters, implementing hospital-based violence intervention programs, developing mechanisms to identify individuals at risk for gun violence, and educating the community on safe gun usage and storage. By investing in these measures, East Harlem can create a safer environment for all residents. And we'll have one more, which is when we separated the one that was going, one for DIFTA and one to HRA. The language, I put it the same except added the elderly, so one extra word, I'm not gonna reread all of it. And then the first one is now focused on domestic violence, so the request is other domestic violence services requests going to HRA. And the language is funding is urgently needed for domestic violence prevention and assistance programs. According to the NYPD, East Harlem has a violent crime rate of 10.3, nearly double the Manhattan and citywide averages of 5.5 and 5.3 respectively. The mayor's office to end domestic and gender-based violence reported that East Harlem has the highest rates of intimate partner violence in the city. Programs that can provide survivors with resources, support, and safety planning are critical. Additional funding is necessary for public health interventions that focus on prevention, education, and community-based outreach to help reduce domestic violence in this community.
Thank you, Jim. We can start right now, y'all, with ranking, because that's the first one. So, the first one would be the domestic violence one. How do we want to rank that? High, medium, low?
Hi.
Isaac, can I make a quick comment quickly about one of the items that was just read?
Please do.
For the LGBT one, I think
Yes.
there's too much within one, if I'm being completely honest. It's too many, like there's like 3 issues that are being outlined within that one, and I think it needs to be split up.
Are they 2 different requests that you're saying should be made? Like, what are the 2 different requests that should come out of that?
There was, it mentioned homelessness, and it also mentioned hate crimes and services and drug use. I think that the drug use should be separate, like programs, like, because I'm sorry, I'm like trying to gather my thought.
I think-
I had, yeah.
I think sorry. Go.
Finish what you're saying first, and then.
Yeah, no, I think that the access to services should be separate. And it should be more specified to health services, whether it be drug related or also just general health services for the LGBT community.
Yeah, I like agree, and I think we had like a million, we had 50 different ones. I think my idea for this one at least was to say, have the ask be like, we need to have LGBTQ plus services integrated into everything we already have existing. And then using all of the other like 12, kind of saying, and the other 12 asks, this ask is saying incorporate LGBTQ plus services into all of those.
I'm gonna be completely honest, just from what I know, integrating it isn't necessarily gonna give people the best care that they can. It needs to be specialized. Because integrated, all these hospitals have these trainings and stuff like that, but I think it has been integrated, but I think it needs to be specialized, is what people need.
Yeah, I mean, I think we could say that as well, instead of integrated, like specialized in addition. Because I think honestly, for a lot, for any population, we can create. We could do the same for immigrants and.
Right, that's why we have, I'm sorry.
But
Yeah,
no, it's hard because it's like, yes, we wanna do that, but. I don't know, yeah, so maybe we reword it to make it clear that it needs to not be integrated, but in addition to.
I think we need to be very careful about the language because people may think it's not something that gets overlooked, but it very much is, especially within our neighborhoods. So I think we just need to make sure that we're putting the specialized in there.
So we just make a word change in that for now. I just also wanna note that last year we had nothing in here on this topic. So.
I think it's.
Yeah, no, I
great.
appreciate it. It's just
No, I hear you. I'm not saying it like.
treading a line.
Yeah, I just wanna track our progress too as well, because we, the fact that we even have this ask in itself and we're talking about it is a lot of progress, so thank you.
Yeah.
And I'm glad you're listening, actually. Cause when I went by it at first, I was wondering if you were gonna come, so I'm glad you circled back. Rosie, you were saying something?
No, I think it's great that we're adding this, where it says, substance use disorder are also disproportionate, I cannot pronounce the word. High within the LGBTQ plus communities, and we have everything that they face challenges on, and I think it's great that we have so much that can target that specific support. I just, it's very descriptive, on what we want, I just like it.
Okay, so let's go back to ranking real quick. So the second one is, the second ask is other programs to address public health issues. And this one was, targeted outreach to the corridors on 103rd, 110th, 116th, and 125th Street for those who are, dealing with substance misuse. High, medium, low. Say hi, I'm gonna say hi. Any objection? High. So number 2 is high. Number 3 is, funding is needed to, I'm sorry, I'm sure I'm reading. Is this right?
Yes, you're right.
Funding is needed to incentivize supermarkets and healthy food suppliers to do business within East Harlem. Okay.
Which is now provide, expand, and enhance food assistance.
That's why I'm going. All right, cool. So, priority?
I think it's high, because if you know what food stamps are now, they were rolled back to pre-pandemic prices, which is like antiquated.
Okay, but I have a question now, because if we're gonna do everything high,
Yeah.
it's like a rug. So I have to say low on this one, because I tried to divide this into three parts, so that it was three equal, high, low, and medium. Unless we don't wanna do it that way.
I think it's for me, it's a medium.
Go for a majority here.
Medium.
I think it's a medium because the prices are very
I
high.
understand,
But-
but just track how many highs and mediums and lows we
Exactly,
have
no, no,
done
no,
with
no,
this.
but that's what I'm saying, like, that's why for me, it's a medium, because even though you're not barely able to afford it, I can just think about all these people that are not able to afford it, and I just spoke to Antonica, how many health funds, because maybe I'll show up.
Also,
Hello.
helpful that this is probably not unique to these parks.
Definitely.
No one could eat any.
I have no objection for rating it higher, I think they're all important.
I still think it's high, but it sounds like a lot of medium.
I said low, because I hadn't prepared, so.
Yeah.
Medium, so it sounds like, okay, medium. You got to eat, yeah.
They're all
Alright.
important.
Ooh, yeah. Alright, so number 4, other senior census program requests. So this is expanded services and culturally appropriate care. But this is bilingual services for the Asian, community. Is this high, medium, or low?
I said, I put medium, that's 5 foot, and that's medium.
Oh, you already.
You put low.
Oh, please. I would.
Fine.
The food is priority.
I'm scared to rank stuff.
I know, the ranking is.
I'm a good medium too with that. on the
Medium.
bar.
Alright. That's what I was
I
gonna say.
agree, yeah.
Medium?
Mhm.
Thank you for the support.
Well, first, we wanna qualify
You don't
everything
need to
by
sneeze
stating
again.
that everything is a high priority.
Yes.
We just are forced, yeah, that's what we should have here, high, highest, or high. Like James.
Yeah.
Right. The solution is always semantics.
Right. Alright, so number 5, other programs to address public health issues. This is on the hypodermic needles.
That's high.
I don't wanna rank that higher than one of the last ones, especially when that's on point, that's already out there doing
I
that.
had it medium.
I'm sorry, that's just my opinion.
The only reason why I'm really considering that high is because I've just experienced working with the Parks Department, people getting stuck with needles and winding up with long-term consequences from that, including kids crawling on the floor in the playground and all sorts of, I've just seen so many instances
Thank you.
that could have been
That's all you had
prevented.
to say.
Yeah.
I would agree that it's high, because it's not just what you see, it's people who are impacted by it, and it's not just people.
Long-term.
It's also the dogs that are pooping on the
Right,
street.
right, alright, so that's a high.
But you know
priority.
something truthfully?
Yeah.
I've been on this committee for 11 years now. This has always been a high priority issue. It doesn't go away. I'd like to see it go away.
We can make it go.
Okay. Okay, high priority, okay, that was number 5, right? So number 6 is increased case management capacity. Yes. This was not split, so this is.
It is split.
It is
It's split. It's now 13, 6 and 13 now.
So this specific one is for the aging population.
For the Asian population, how we gonna rank this? Priority?
I put it as low or high as opposed to high.
I'm gonna do a medium.
Do we have to have one?
Well, that's the question, is this even matter? Does it really matter?
A low priority.
No, I wanna say medium because it's not like it doesn't exist, we want it
Like,
to
we
increase.
need it, but
Yeah.
not urgently, like.
Yeah,
Yeah.
but it's a very valid question, because by basically ranking it low, all we're basically signaling to the agencies and the city hall that we don't need to care about it, then we should never rank anything.
For us, am I not right, am I right?
No, I think we're
Is it
sending it.
ranking for us or for?
The ranking is for here, then I send it to the board office, they send it to the budget committee, and then we rank it with all the committees. 25 expense for the capital.
But we do send it off
Also,
to,
our rankings do matter if we put it out.
right, so therefore, if we don't, if we're
Why
everything the
can't
same,
you
then
put everything
it's
in top?
basically
Can you
means
just do
nothing.
that?
You can.
But then we're not really having a say in which ones are the most important.
Can they decide versus us decide?
I said.
Well, if we
I
don't
s-
care about it, they're not gonna care
Well,
about it.
I
so-
understand that, but
Can we say that we just believe everything is a high?
Yes,
That's what you just said.
Yeah.
Yes, but
Yeah.
then
The
the mayor
older-
decides.
yeah,
what's
older is
occupied
passing
instead of
on the
what's
exec-
decided.
Right. this
No,
last
we'll
election.
put medium to be,
I understand.
Yeah. I think.
Alright, so,
We should say if this doesn't happen in apocalypse. we'll take it. That's what I read, it should be apocalypse now or apocalypse later.
Right, that's a very, I like that, I like those semantics even better.
so can we rank the same one, case management for 13, which was what?
Yes.
That's for,
So you're both,
in general,
so
right?
you're going for medium on that?
One was HRA, the other one's this.
So we could do medium or low, medium, I guess.
Alright, just so we know,
Just to keep
we
them-
have 7 so far we've ranked, there are 3 highs and 4 mediums.
Okay, cool, that's not bad.
Okay.
All right. So number 7 is, vaccinations and immunizations. How we wanna rank that?
Medium.
I had another joke coming, that's another one coming, based on the fact that one here.
Because
smack
not,
the table,
because not
that's
for
a high
nothing,
price.
like, it's not like vaccinations aren't available, some people just
Well,
don't make the choice.
That's basically what my
to take
thinking
their
has
children and
been.
get vaccinated, cause sometimes you don't need grown-ups to tell other grown-ups to get their
The
kids.
city is a
I'm
very.
sorry, my husband has insurance. He was denied by 2 pharmacies to get COVID vaccine.
But there were
That's
a
not gonna change
litany
because of
of,
this.
But
Places
but
that
what
you
I
can
liked
get COVID
about the
vaccine.
Department of Health one is they'll take anybody.
so there was an option.
So that needs to be promoted.
Also,
And it's also the
understand.
culture too.
That too.
You know, because
Yes.
I've seen a lot of one specific culture that did not get the vaccine because they thought that they were trying to assassinate that specific culture.
These are all somehow made it, because we actually think they're all important, and so agree, but we're talking about gun violence and we're talking about vaccination promotion, and we're saying we're ranking them both high.
No,
It's
we
like,
saying that that's,
you know,
I'm
it's-
saying that that's medium or even low.
Me too.
I
I agree
doubt
with
go
medium,
low.
yeah.
Fine.
I mean, I'm with y'all on the
Okay,
media,
because-
it's still important, it's important
Yes,
in a different
it's
way,
all
people are gonna die from this.
All right.
Some people were dying from COVID, just, you know. it's-
I literally just read today the statistics in South Africa. You know how these kids don't have access to vaccines or clean water, and they dying of malaria and cholera. That's what, that would be high,
Yeah.
not here in this country where we got people, you could just go get you back,
Yeah.
like, let's stop it.
We just have crazy people,
So the next-
that science doesn't work.
Yeah,
The next request is, animal and pest control, including reducing rats and mosquitoes, how we wanna rank that? Medium?
I put medium.
I put low.
the rats would say no.
They will.
I just have a question. You said somebody gave some update lately about this. What was the
What?
update?
With number 8,
Nine?
number 8.
What was that, the
But
rat?
and we on
We had a
that,
presentation last
Oh, you
meeting
mean-
about mosquito.
Oh, yeah, yeah, you gotta take a look at the, it's in the minutes as well that you got today.
Oh, no, I thought like the person gave like some statistics, like what was being done.
Well,
and
she's from DOHMH, and she didn't go into too much depth, but she did answer questions about the mosquito
the
spray.
mosquito she
and
did,
how-
bunch of rats.
Yeah,
And if you wanna get a scare, read New York Times editorial by Fauci today, Anthony Fauci, who said the sickest he's ever been, he almost died from a mosquito bite in his backyard, he got West Nile.
Wow. Well,
So,
there was some mosquito outrage and I don't know where that the pregnant women will get infected.
And now you get it, you get
And then the
it.
baby would die.
what, is that
Florida.
Nile or Zika? That was. that was-
Who's Florida?
it was in Florida.
Mhm.
It was
Okay,
head-
I'm gonna.
So,
I'm
we
gonna-
gonna-
Yes. How do you wanna
Keep going, keep going, keep going. So what did we rank 8?
So what was number 7?
No, it's 8, we're actually, it
number 7,
was 8 medium.
Yeah, we-
Yes, 8 medium.
Okay.
Number 9, allocate funds for outreach services to homebound older adults and for programs that allow for elderlies to age in place. I'm gonna say high priority.
Thank you.
Just because I'm at a church where I see a lot, I'm starting to see, a lot of the, members just not. being-
Very easy for them to fall between the cracks.
Yeah, I wasn't noticing it before, so, but that's just me personally, so that's my rating, what are we gonna do? It's up to y'all.
I had it as medium, but again, given what I'm doing.
I had
in the
the
law,
medium,
so
I put medium too.
we got a lot of mediums though. so-
I got high.
I'll go with high too. But I have.
I did medium, Mark did medium.
Alright, Jen, you the top one.
And
Straight out of media, so you can have
Me?
Oh,
Yo, wow, tough decision, come
Yeah.
on, guys.
don't push her, see you pushing her.
Don't sit on the fence.
Alright.
Stay.
No, I mean, I was thinking medium,
Then that's it.
So that's.
She gave eye contact.
Oh, you can't be down there and doing.
I wasn't even.
No, she got my attention because I was looking at,
I just told
Okay, cool. So the next ones are updated ones. I'm gonna pass it over to Jim.
So 10 is other requests for vulnerable New Yorkers. This is the LGBT.
How we wanna rank that?
I had a meeting.
Me too.
I think it's high because it's our first request this year and we're making progress and we've never had this and there's little to no information or services out there. So we'd love to see
And the fact that there's not even like, in the needs of this.
one out of.
You're vulnerable New Yorkers.
I've been sold. I'll say.
Or say hi.
Any thoughts? Okay, 2 for high, no,
There's 3 for high,
Medium.
5, 4, 5, 6.
Okay, we do high.
There we go.
The highs have it.
The highs happen. That's a high priority.
so it's high?
It's high.
It's a very high.
No, 11 is a high.
11 is high. That's what I read, that's
That's
high.
high.
All right, come on, Jim.
This is great inflation, this thing all know.
11 is another services for vulnerable New Yorkers, and this is migrants and asylum seekers.
Yes, this is high.
Yeah, that's high. Okay, so we have.
12 is
That's the second gun violence one.
Oh,
Yeah, I think it's
higher than one.
similarly high.
And then 13 we already did, that is,
Medium.
yeah, yes.
Okay, so both of the violent ones are high.
So we had 6 highs and 7 mediums, that's the final count. No lows.
Okay. So we are. I'm gonna push us through the rest of this. Are we, so can we vote, Marlene, are we in a place where we can vote on what's been already read on the floor? The changes have already been made.
That's up to you to decide if you all are not.
So, is there a motion to support the existing budget priorities that we just confirmed and ranked?
Yeah.
Second.
Okay, so there's a motion by, Rosa, and we have a second by our niece. Okay, can I do a vote by acclamation?
Yes.
All in favor?
Aye.
Ayes have it. Great.
I mean.
I thought you could not do it.
No,
I didn't wanna.
Because
But
it's
this is
a
a
lot.
good point.
But we don't.
Yeah, I wish I did today, some memories that not going on here.
No, but thank you for saying that. Let's just clarify for
Yeah,
all board members, so you know. This is not to you, Aaron, but we just this just brought up something that people should know. If you don't come into the meeting
Mhm.
and you are online virtually, you are absent.
That's your qualifying.
Yes, unless you have filled out a form for qualifying disability.
You have to have a
24 hours, huh?
You have to have a let's be clear.
You have to have a
It's not
qualifying
an absent
disability.
form.
Yes.
I know some people are using it as an absent
Yeah, it's
form,
not.
but it is, you have to have a qualifying
Yes.
disability. We will not question you, it's none of our business. But
Right.
you have to tell us 24 hours in advance, please,
Yes.
of the meeting that you are eligible for this qualifying disability. If not, send Isaac or myself or put us both in an email and ask to be excused for the meeting.
Yes.
But to be clear, qualifying disability seems to be if you're have a temporary illness, it's not
Yeah.
an
It can be
ongoing.
temporary
It's
or
not an ongoing, right, it's not an
It can be
ongoing
temporary
disability.
or ongoing, and there are
Shouldn't be on.
parts on the form.
Right.
I'm sorry, excuse me. It can be temporary or ongoing. There are 2 parts in the form that says, is this temporary or will it be permanent?
Right.
So you check off either box that pertains to.
Yeah, just when I.
So, yeah, and just for the record, Ashley's good on that regards. So just wanted to say that, but we did need to say that so that people don't think, oh, I'm gonna just do it virtual today. No, you're not.
Yeah, I
You
learned.
need to be here.
Well, you can still participate.
I need a form.
I was there, but there was nothing.
I'm sorry, it's hard to hear. Did my vote count? Yes or no?
Yes, it did.
Yes, your vote
Yes,
counts,
it did.
and your
Yes,
voice
it
always
did.
counts.
Sorry, yes, we are shenanigans. All right, so we are, okay, so that's good. Budget stuff is past us. The next time we will circle back on this will be when we are drafting our section of the literature of the statement of district needs. So there is a section in there that is dedicated towards the Health and Human Services Committee. For the past few years, I've been the only one going in there editing, and updating the edits, especially because I really didn't like how it was articulated before, but I would love for you all to contribute. So once they let us know about that, that'll be something I share with you all to contribute. And it's just to give your thoughts, comments on the language, because this is the language that goes to the city and it expresses how we articulate the issues. So even if we said something was a medium priority, we can still articulate it as a high priority in our statement, right? So we have strategies here for our advocacy. So with that, I'm going to move us along to the last, okay, so discussion to finalize committee goals. Okay, here's what I'll do for that, right? Can everyone take one of the council ones? Take a look at them when you get home. I could also share the document, but these are the goals that I read off at when I gave updates in September, I gave these, goals. Because these were goals that I believe came out of our meeting and were mine. I would like for us to actually draft some goals that are collective. So, I just gave y'all this so y'all can see how I express goals. What goals do we have for the next year? We got a lot of spaghetti on the wall. I definitely wanna take, I don't know, how we gonna do this. I can scan that. So I have, I'm gonna scan this.
My hard work.
Right. I'm going to scan this, so we all have a copy of it. No, there it is. Yeah. You can do one, so take it, but, oh, we're gonna just, we wanna, start to talk to those, flush those things out, invite some of those people, because some of that was invitations to commissioners, DOT, I heard, so we need to get people here. All right, so that's our discussion on goals, we finished that. I'm going to ask you all to, the next meeting, I will let you know on the agenda in old business will be a continued discussion on our committee goals. And that's where we'll actually talk about the goals. We're not gonna hold it here tonight to do that. So please come prepared to talk about goals. Please don't be like, yo, you sent that in the mail? No, I didn't send it. Let's just talk about goals. Thank you very much. Appreciate it. Any goals you have? Today was great. I love that everyone has so much input and feedback. Takes so much pressure off of me. You know what I mean? So I'm thinking about it a lot, so I love it.
Sorry. Are you, no, are you finalizing goals tonight? Does it has to be finalized this month?
We can take these goals I got here as finalized.
Okay.
And then, later we're gonna draft some, year goals. That's what we're calling yearly goals. That will be, so yeah.
Send this out?
I'll send this, no, but I'll share it with you. It's in our September meeting.
Okay, I will put it. It's on
It was
the
what I-
board member draft?
Yes, it's in the September meeting. It was what I gave for updates. So this is what I mentioned. So this, we can put this as that.
Okay.
I feel like, yeah, and if anything from these goals, the second one is the one we're still working. I think we've already accomplished our first one in the third one. Second one is what we're doing, identifying our advocacy strategies, for the different things. Is that cool, Molly?
No, it's okay.
No,
I'm
I'm
gonna
in
go on
favor.
the board member draft.
Yeah, it's in the ground.
Yeah.
Oh,
fine.
board drive, do you all know that we have a board drive? I keep all of our materials in there. Every month's materials are in the folder, so you can always find them, so you don't have to ever wonder where it's at. Lastly, another thing that we'll talk about more thoroughly next month, which we'll have to do next month. And I'll put, it's gonna be too much budget clouds conversation anyway. We are, planning a forum, for December around, addiction and substance abuse. That was something we had voted on earlier in the year. We need to flush out what that looks like. I will email you all with the actual description, purpose of the event and all that for you all to give feedback on, critique, think about who we should have in the room. I'm connected to Harlem Strong, which is, a coalition, of the Public Health Center, for CUNY, with Deborah Levine. And they have a lot of people who presented on community strategies for dealing with substance use that I would love to have come and present at this event. The goal is to have a few discussions, maybe a few speakers, who just come on for a few minutes to talk. Maybe some folks can give testimony, but the goal is to be able to form community-based strategies for, you know, dealing with those who are, who need support in our community. So that's the other thing we'll talk about on old business, because we have to get clear on it, because December is going to be the event. So we don't have in-meeting planning time. So November will be our planning time for that event. I will designate time for that, but beforehand, I will email you all stuff, and I will text you and bump you to let you know I sent stuff. And if I didn't, follow up with you personally, like Alita, Marcel, there's still some of y'all I haven't gotten a hold of, individually, so I am gonna try to find some time to meet with y'all, just so we can build. But yes, so there, you know, we can plan off meetings, but next meeting will be a planning meeting for that, along with our presentations. That's all I have. Are there any questions, comments, concerns about anything?
I have a question about the forum.
Yes, please.
This is a public forum.
It will be.
Where are you thinking of having it?
Rosa, we'll be thinking of having.
It's Harlem Community Partnership.
I don't know, but I asked the people who know venues to look at some venues. So if you all know venues, we can.
I was just thinking that, you know, November is our meeting and the event is sometime in December. I want to know that everybody has enough time to support it.
Yes. We're gonna make sure as soon as we confirm, and that's what I'm gonna bump Andrew for tomorrow, a date, maybe we can confirm. And I don't know if it's a matter of the venue will confirm in the date. If it's about the venue, then maybe.
Right, we need a date.
We
We need a date because we're able to obtain light refreshment. We're able to get little, I don't know, to go little gift and notebook with pens, et cetera, et cetera. They're gonna find out probably tomorrow when I email them the link of our meeting.
Okay, so that's a.
It's that.
Okay, perfect. So we'll get set on that. Perfect. Thank you. This is perfect.
Thank
Where's
you.
the
East
venue
Harlem
at?
Community
You said 115th Street?
71 East, 111.
Oh, that's in between, Madison and Park. Yeah, oh, I know that. I never been there. I'm gonna go.
It's gonna love it.
Okay, good.
Yes, everyone is welcome.
Perfect. So we just need to confirm the date. All right, great. So the meeting, if no one else has anything, I can adjourn this meeting. Does anybody have anything else?
No. Motion to
Burning?
adjourn.
Okay, is there a motion to adjourn?
Motion to adjourn.
Oh, yeah.
Oh,
I always forget.
Yes,
Let's do roll call, y'all.
Okay.
okay. Mark Gursky,
Still here.
Marcel Bodina is on Zoom and will be marked absent for this meeting. Rosa Diaz,
Present.
Arnice Hernandez,
She's here. I just heard her.
Jennifer Meyer. Present. Valerie Fontaine. Asher Rodriguez is on Zoom and will be marked absent for this meeting.
I'm present. Sorry.
After has paperwork now.
She has paperwork?
I think so.
Okay, well,
Just double check, but I believe. I'm present.
Okay, if you saw this one.
Yeah. No, I didn't. I got a confirmation, but I didn't sign a confirmation, so you would have to check.
I was double.
I'm sorry.
This is what's so confusing, by the way, when it's given at the 11th hour.
Yeah.
Registration,
Yeah, present.
Alita Shishambu.
I'm here.
Did I say it right?
That's okay, let's close.
Okay.
I say it with a T.
Did you say Alita?
Yeah, just get the T.
Did you say Alita?
The T, the she sign. Alita is fine, yeah.
Okay.
Alita T.
Thank you. You can adjourn.
Okay, oh yeah, I'm present and, okay, so the meeting is adjourned at 8:20. Thank you. I did my best.
You did great. You did great.
This was the most fun budget meeting I've ever been.
I had one that students one year. All spelled their first name the same way you spell your first name. 3 different pronunciations.
Oh my God.
There was an Alita, an Alida, and an Alan. And an Alan.
But you're the island, right?
If you name your email.
The French name would be out.
It is not email.
So she must have a French
Definitely,
name.
she kept it French, but I like that. I like that. I would have never.
Stop recording.
I would not write it.
Who knows? That's why I always see that name now, I don't really pronounce it.
Right, so then I took that.
Mark is usually.
I know, right? It was a busy.
That connection with my directors and.
Wow.
So
Okay.
hopefully there'll be something in.
Now, I can't promise that your other meetings will be this cool.
Oh, yes, you can, yes, you can, Isaac. Where's the bar now, Mike?
I gotta stand, but listen, I gotta be able to, hey, Alex, you listen to Alex, we wanna start.
Oh, we Wednesday.
Yeah.
Compliments to Jennifer.